Does shoulder pain keep holding you back? Let's uncover the truth about shoulder labral tears and how you can finally find relief. Hello, I'm Dr. Siddharth Tambar from Chicago Arthritis and Regenerative Medicine, expert in rheumatology and regenerative medicine. Here at Chicago Arthritis, we focus on innovative non-surgical solutions for musculoskeletal conditions to help you live a pain-free and active lifestyle. Today, we're diving into an important topic, shoulder labral tears. Shoulder pain can limit your ability to work, exercise, or even sleep. One common cause is a labral tear. But what exactly is it? What causes it? And most importantly, how can it be treated? In this video, we'll explore everything you need to know about shoulder labral tears, from symptoms to cutting-edge treatment options. The labrum is a ring of cartilage that surrounds the shoulder socket. Its job is to provide stability and support to the shoulder joint, which is one of the most mobile joints in your body. A labral tear occurs when this cartilage is damaged. There are a few types of labral tears. The most common type is a slap tear, which stands for superior labrum from anterior to posterior. It often affects athletes who perform repetitive overhead motions, like pitchers or swimmers. Another type is the Bankart lesion. That occurs at the front and bottom of the shoulder, which occurs after a shoulder dislocation and can lead to chronic instability. Lastly, we have posterior labral tears, which are less common but can occur from trauma or repetitive stress to the back of the shoulder. There are several potential causes of labral tears. Trauma. This includes falls, car accidents, or direct blows to the shoulder. Repetitive overuse. If you're involved in sports or activities that require overhead motions like throwing or swimming, you're at a higher risk. Age-related degeneration. Over time, the labrum can naturally weaken, increasing the likelihood of a tear. Poor shoulder mechanics. Weakness or instability in the shoulder can create excessive strain, leading to tears. In most cases, it's a combination of these factors that leads to a labral tear. Instability related to weakening or injuries to the shoulder ligaments and tendons are a key mechanism for why the labrum gets injured. So how do you know if you have a labral tear? The most common symptom is a deep, aching pain in the shoulder. You might also feel a clicking, grinding, or catching sensation when you move your arm. Many people experience reduced range of motion or shoulder strength. Instability is another hallmark symptom, especially during overhead movements. Finally, shoulder pain that worsens with specific activities like throwing or lifting is a red flag as well. If you're dealing with these symptoms, it's important to get evaluated by a specialist. Diagnosing a labral tear starts with a detailed evaluation. First, your doctor will ask about your symptoms, medical history, and activity level. Then they'll perform a physical exam to assess your shoulder's range of motion, strength, and stability. If your pain is triggered with maneuvers that stress the labrum, that is suggestive of a labral tear. Imaging tests are often necessary. An MRI with contrast dye is considered the gold standard for detecting labral tears. Diagnostic musculoskeletal ultrasound is another tool that can provide real-time insights into shoulder's structure and function, such as the rotator cuff tendons, but it is not adequate on its own to fully evaluate the labrum. These steps in total help us to confirm the diagnosis and guide your treatment plan. Most shoulder labral tears can be managed without surgery. Conservative treatments include rest and activity modification. Avoid activities that aggravate the pain, especially repetitive overhead motion. Physical therapy. A structured program focused on strengthening the shoulder and stabilizing the joint can be highly effective. Anti-inflammatory medications. These can help reduce pain and swelling in the short term. You don't want to use those long term, however. Nutritional support. Supplements like omega-3 fatty acids, curcumin, or collagen may support healing and reduce inflammation. These steps aim to reduce pain and improve function and prevent further damage. For patients who don't respond to conservative care, regenerative medicine offers advanced non-surgical options. Platelet-rich plasma, or PRP, involves taking a small sample of your blood, concentrating the platelets, and injecting them into the damaged area. Platelets release growth factors and stimulate repair and reduce inflammation. Bone marrow concentrate with stem cells. These are harvested from your own body and injected into the shoulder to more significantly reduce instability and inflammation around the damaged labrum. Bone marrow concentrate is a stronger treatment than PRP on its own. These treatments are safe, effective, and allow you to heal naturally without invasive surgery or harmful medications. The key to these treatments is to treat the entire shoulder functional unit. That includes not only the labrum, but also any weakened or injured ligaments and rotator cuff tendons, and sometimes the joint as well. In some cases, surgery may be unavoidable. This is usually the case for severe or complex tears. The most common surgical procedure is an arthroscopic labral repair, where the torn cartilage is stitched back into place. For larger or irreparable tears, a labrum reconstruction may be necessary. While surgery can be effective, it comes with risks like stiffness, prolonged recovery, and potential complications. That's why we prioritize non-surgical treatments whenever possible. Prevention is key, especially if you're active or prone to shoulder injuries. Focus on regular strength training to improve shoulder stability. Learn and maintain proper technique during sports or exercise. Always warm up and stretch before physical activity. Lastly, avoid repetitive overhead motions without adequate rest. Taking these steps can significantly reduce your risk of developing a labral tear. In particular, as we get older, it's important to make sure you are doing different sorts of activities, not just focusing on only one sport or activity that puts your shoulder at more risk for developing a tear. If you diversify and add in other sorts of activities and sports, you'll maintain your overall health and also reduce your chance of risk of injury. Thanks for joining me today to learn about shoulder labral tears. If you're struggling with shoulder pain, there's hope. At Chicago Arthritis, we specialize in non-surgical treatments like PRP and bone marrow concentrate-derived stem cells to help you regain your mobility and live pain-free. Visit us at chicagoarthritis.com or connect with us on our social media channels to schedule a consultation. If you found this video helpful, don't forget to like, subscribe, and share. Until next time, live well.